I am 3 days into my recovery from dental cavitation surgery, and I want to tell you how it's going and what I'm taking to get better as soon as possible. So, welcome back to the Energy MD podcast. My name is Evan Hirsch, and we help you resolve your chronic fatigue syndrome and long COVID so that you can get back to living your best life. So if you're watching this on YouTube, you can tell that I am quite swollen through mainly the lower jaw on the left and the right. So I do look a little bit different. And I am having a little bit of a hard time speaking. So if you'll bear with me, I do want to share this information with you today. So I had my procedure on Friday, and I had it done with Dr. Esther Min up in Tacoma, Washington, and I was very pleased with the procedure. I felt supported, I felt safe. They talked me through everything. They were very kind and compassionate. I believe she's very skilled at what she does. I did a lot of research prior to coming to see her. She's not only a dentist, but she's also a naturopath and has a number of other skills, and I had several conversations with her prior to having the procedure. And long story short is that I got over my chronic fatigue syndrome about a decade ago, but I've had some lingering symptoms. And then a couple of years ago, or a year and a half ago, I started having some sleep issues. And so I've been curious about whether or not the cavitations are part of it. So I finally got them evaluated. It did show that I had dental cavitations, which are a result from the wisdom tooth extraction that I had almost 30 years ago. So when they extracted the wisdom teeth, they left a hole in the jaw that ended up filling in with fatty necrosis, which basically is dead tissue and chronic infection that ends up seeping into the rest of the body and causing chronic inflammation. So I'm hoping that this takes my energy and my health to the next level and fix my sleep and whatnot. So um, so overall, I do feel like the process is going well. Swelling has decreased every single day. Sleep has improved every single day. Pain has decreased every single day. I actually haven't taken any pain medicine today. I was given tramadol to take every 4 hours or so. And I took it 3 times a day for the last couple of days, but I have not taken any today, and I don't really feel the need to. I want to share with you the protocol that I'm going through because I found it to be very supportive. So let me pull that up here. So when I first wake up, I start off by taking some adrenal support and some DHEA because these are going to be helpful for the stress response that the body is going through. I take trisalts, which are going to make my body more alkaline, which is really helpful for healing. I take the antibiotics. So I'm generally opposed to unnecessary antibiotics, but I am okay with necessary antibiotics. And so when a doctor that I trust who has this balanced approach tells me that it's really important for me to take the antibiotics because it's going to prevent infection, and then I have also heard from some of my clients that they had waited on the antibiotics and they hadn't taken them right away, that they had some problems at post-cavitation surgery, it definitely gives me pause and makes me want to take the antibiotics. So I'm taking Augmentin twice a day. And then I'm also following it up a couple hours later with spore-based probiotic to repopulate the gut and prevent any damage, long-term damage from the antibiotics. Hydration is very important in this process, and I am putting electrolytes to make the body more alkaline in my water, but trying to get 3 liters of water per day. Interestingly, this doctor also recommended some detox foot pads that you can put in your shoes, and then as you walk around the house or at your work or whatever, you end up bringing in the binder or whatever is in the foot pads that ends up helping you detoxify. I start the day off also with some bone broth with collagen, garlic powder, sea salt. You do want to increase your protein. You do want to increase, the bone broth is really helpful for the collagen that was recommended by her. I made some before I went in for the procedure. I set a timer on my Instant Pot and I created a very nice soup, which had a bunch of vegetables. They were not as soft as I needed, I actually needed more of a mush at this point, so my wife is Vitamixing it. Um, so I have the soup, which is bone broth, some collagen in there, and then also these vegetables. And then also I had some beef in there as well. And so all of those things are giving me more protein, they're giving me the bone broth, they're giving me the collagen. And then at that point, so I'm kind of taking you through my day. At that point, I brush my teeth. And I'm only allowed to, brush in the first part, not able to go back. Um, and I'm utilizing the dental Sidon, which is a toothpaste by Biocidin, which is a very good toothpaste that I recommend. And then I rinse my mouth with a product called Stella Life that I'm going to talk a little bit about the research in a minute. It's a three-step process where you have an oral rinse, and then you have a spray under the tongue, and then you have a gel that you apply just to the area. So let me tell you a little bit about the research on the Stella Life. So generally, the gold standard for post-oral surgery is to use chlorhexidine, which is like an antiseptic mouth rinse. And so Stella Life is homeopathic. It also has 16 different active botanical derived ingredients. And the research shows that it is quite equivalent to the chlorhexidine without a lot of the side effects. So in one study, in vitro studies that compared them, the Stella Life and the chlorhexidine, found that the Stella Life exhibited far lower cytotoxicity to oral fibroblasts and stem cells, which means it killed less fibroblasts and stem cells in the mouth. And Stella Life showed no significant toxicity, while the chlorhexidine, even at lower concentrations, caused substantial cell death. There was also some scratch wound assays done that showed that cells exposed to the Stella Life had similar or slightly improved migration and wound closure compared to the controls, while chlorhexidine conversely led to persistent wound margins due to cell death, with Stella Life promoting better cell migration and collagen deposition critical for healing. So we really want healing cells to come to the area and the collagen to be deposited in that area to have better healing. And it sounds like, according to the research, Stella Life does a better job of that than the chlorhexidine. And then in terms of post-operative pain, research suggests that Stella Life can reduce pain intensity following oral surgery. In a cited clinical pilot, patients using Stella Life reported lower pain scores and delayed need for opiate rescue medication compared to those not using it. The average pain score for the Stella Life group was 5.6 versus 7.1 for the opioid group during peak pain intervals after surgery. And that studies and case reports suggest that Stella Life may reduce the need for opioids in private oral surgery practice. In terms of antimicrobial action, laboratory research found that Stella Life significantly inhibits the growth of pathogenic oral bacteria, so Fusobacterium nucleatum and the Pseudomonas gingivalis, while showing lower toxicity to benefit oral bacteria compared to the chlorhexidine and other traditional rinses. Stella Life oral rinses also enhanced fibroblast migration, as we mentioned, and collagen production in vitro, both essential for all tissue repair without the detrimental effects associated with other antiseptics. So indicating that that is supported with biocompatibility. And there's been several case studies and patient experiences, including use during cancer treatment and for trauma-related oral ulcers that report improved healing, less discomfort, and elimination of opioid need post-surgery. And right now, Stony Brook University and Rutgers University are conducting additional clinical studies on the efficacy of Stella Life for oral disinfection and gingivitis control. So I'm pleased with the product. I do believe that it's helping me, and it sounds like it's a nice alternative to the chlorhexidine. So the next thing that I do is I take a binder 90 minutes away from everything. One of the things that Dr. Min mentioned is that um, when you are removing the cavitations and these infections, they release a lot of the heavy metals that are bound to them into the system. And so you need to be taking a binder and other natural chelating agents in order to bind them up. So she gave me a product that was bentonite clay largely. And I've been taking that twice a day. She just wants that for the first couple of days. And then once a day onward. I'm going to mix that up also with the other binders that I take, and so that I can also get some zeolites and some activated charcoal and some other chlorella, etc. But that's something that we see also when not only when we're going after the toxic five, so the heavy metals, chemicals, molds, infections, and nervous system dysfunction that I talk about a lot when I talk about the real root causes of chronic fatigue syndrome and long COVID. And when you remove one of those toxins, the other toxins get released into the system, which is why it's really important as part of our process that we're addressing all of these causes as we move through the process, essentially getting to a place about 6 months into our protocol where you're taking all of the products that you need, and then it's just a matter of time before you get rid of the toxic five out of your body and you achieve real healing. In terms of other supplements that are supportive, vitamin D, 10,000 IUs per day, vitamin C, vitamin K to help with the healing and the clotting, and acetylcysteine or glutathione, fish oils, all of those are recommended and supportive. And those are going to be taken twice a day. And that's it for the most part. I feel very grateful that I'm 3 days in and I'm upright because I've heard that that's not always the case for everybody. And I do feel like a lot of this is due to the protocol that I'm taking. I also rested for the last 2 days, basically just sat on the couch and watched TV shows and movies and tried to just proceed through the protocol, taking the supplements that I needed, make sure that I'm staying hydrated, taking my bone broth, taking the supplements, etc. So hopefully that was helpful for you. If you are interested in seeing whether or not cavitations are playing a role in your healing journey or inhibiting you from healing, I definitely recommend Googling biologic dentist and cavitations. You want to make sure that they're talking about cavitations on their website. You want to make sure that they have a cone beam CT in their office and that they know how to read a cone beam CT because not everybody does, and not all biologic dentists are created the same or have that same training. I do recommend that you go to IAOMT.org, International Association for Oral and Maxillary Toxicology. This is an organization for biologic dentists, though you do have to do your research there as well. All right, I hope that's helpful for you. If you are interested in seeing if we're a good fit to work with you to help you get rid of the toxic five and guide you through this process, you can go ahead to energymdmethod.com, click on the masterclass, go ahead and watch that masterclass. It's 40 minutes if you watch it on 1 time speed and 20 minutes if you watch it on 2 times speed. And there's a button below that video after you watch it where you can click on that and you can get on a free call with me where I'll go through a process of seeing whether or not I believe that I can help you by asking you a number of questions. And then if I feel like I can help you, then we can kind of go into what's included in the program and the investment, etc. All right, so yeah, click on that link if you're curious to see whether or not we can help you. And I'll see you in the next episode. Thanks so much for being with me today and bearing with me while I finagled this the swelling in my face. All right, have a great day. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.